My name is Hector Garcia. I am professor of medicine at Georgetown University, and I am also the director of invasive imaging coronary at MedStar Washington Hospital Center. It is my pleasure to present to you the feasibility of a porcine AV shunt model to assess acute thrombogenicity in bifurcation stenting using optical coherence tomography. Thank you, dear Mr. Chairman of the European Bifurcation Club, for this kind invitation. What we did is shown here at the upper left. So we have used a pig model from where we have taken the blood of the carotid and connected to these tubes. And the tube was connected to our silicone bifurcation model, as shown here in the picture. And then the blood would exit at the other end and return to the jugular vein of the porcine model. We will keep this going on for 1 hour, and thereafter we will check the optical coherence tomography for the presence of thrombus. These are the models we have used. We have used a decay crash model. You can see here the microscopic view, and we also use a culotte model. The panels in the middle are simply the fluoroscopic images as shown here. What we have done is two pullbacks, is one pullback coming from the distal main branch, going into the bifurcation, and then moving into the proximal branch of the section of the main branch of the bifurcation. Then a second pullback coming from the side branch, and then imaging these portions. The ones that we have eventually analyzed are shown in this color, and it can be here seen at the bottom of this slide. This is one of the examples that I like to discuss with you. Is a decay crash example. So this is the microscopic view of the accumulation of thrombus in the side branch right after the bifurcation, as we can see here. So this is zoom out, and at the bottom left, you see the thrombus attached to the struts, and also here on the proximal main branch, although in the microscopic view is not obvious. We did a three-dimensional reconstruction. These yellow arrows point at the accumulation of thrombi, and you see here as well on this other longitudinal view at the lower bottom of this image. This is presenting the areas of the thrombus that we have measured. So in green on the left-hand side, the decay crash models. On the right-hand side, the culotte stenting models. And as you can see here, we observe actually thrombi in all models, but the bare metal, the top two models, accumulated more thrombus than the drug-eluting stent model, as shown here at the bottom. So the accumulation of thrombus was present mostly in the bifurcation segment of all these segments. And as you can see that the bifurcation was affected here in the decay crash in the bare metal stent, but also in the culotte stenting and in the drug-eluting stent model and in the drug-eluting stent culotte stenting model. But the size and the amount, of course, was more in the bare metal stent altogether. And also altogether, I would say it was mostly accumulated in the culotte stenting than in the decay crash stenting. So we have extended our observations, and this past year, what we have done is to evaluate two different drug-eluting stent platforms. We keep our bare metal stent as control. We use an abluminal polymer sirolimus eluting stent, and we also have this durable polymer everolimus eluting stent. So again, at the top row, what we have is our decay crash model. At the bottom, we have our culotte model. And in green circles, we are showing you the portions of the bifurcation with no thrombus, and in red, those areas of the bifurcations with thrombus. So as you can see already, we see more red circles at the bottom row, which is the culotte model, in all of the different stent platforms. We see many less in the decay crash arm. of course, it's obvious for you as well to see that the decay crash thrombosis occur mostly in the side branch, portions of the model, and in the decay crash remains mostly at the bifurcation, but also in the side branch, but the rest of the models do have thrombi right at the bifurcation. At the top, what we have here is kind of the conclusion of this new analysis that has been submitted, is culotte stenting is associated with more thrombogenicity, mostly at the proximal main branch in the durable everolimus eluting stent, and also at the side branch in the bare metal stenting, and also at the bifurcation of all the other models. So the decay crash demonstrated mostly thrombogenicity at the side branch of the bare metal stent and the abluminal polymer sirolimus eluting stent. So this is leading me to my discussion slide. So the number of thrombi with culotte stenting was more compared to that of the decay crash, 13 frames versus 17 frames. And these findings might explain why in the decay crash 3, we see a superior performance of this decay crash model than the culotte stenting model. In the decay crash stenting, the durable polymers show no thrombose, and the bare metal and the abluminal sirolimus stent had some thrombus, mostly in the side branch of the model. This might also be consistent with the findings in the decay crash, where our durable polymer everolimus stent show significant reduction in TLF at 3 years. So this brings me to the single conclusion statement that I have here. I think this model is showing us for a second time some hypothesis generating findings regarding the distinct thrombogenicity patterns of these bifurcation stenting techniques with different stent platforms, in this case, durable polymer and abluminal polymer platforms. Thank you for your attention.